All right. Thank you, everyone who is joining us today. We have very serious issues to discuss, and I am grateful that you're using your time to hear us. I'm Alicia Priest, president of the Oklahoma Education Association, and I'd like to just briefly introduce some folks who will be joining me this morning. If each of you can give a wave when I call your name. Jamie Cole of Oklahoma Advocates. Morgan McClellan is an incoming high school superintendent. Dr. Dwight Scott, president of the Oklahoma chapter of American Academy of Pediatrics. Mary Best, president of AFP Oklahoma. And Clark Fraley, executive director of Pastors for Oklahoma Kids. Thank you all for being part of this conversation today. It is critical.
Hi, good morning. I'm Jamie Cole. I am with Oklahoma Advocates, which is a Facebook group of over 65,000 members. I teach fifth grade math. My husband teaches art and media at the high school. I would like to start out by saying I love my students. I've taught for over 20 years. I think we can all agree that everyone, students, teachers, parents, support staff, and administration, we all want schools to start and return to normal as soon as possible. To do that, we have to be doing our part now, and that means wearing a mask when you leave your home. While the discussion is not about partisan politics or denying individual freedoms, it's quite simply about the health and safety of our children and the education professionals who work with them every day. In my situation, I have RA, my husband has leukemia. My district is very supportive and have encouraged us to use whatever PPE we feel comfortable with. However, that's not the case for everyone, and many educators have expressed concerns. They have health issues or a loved one does. We are in a pandemic with cases rising, not falling. The curve is not flattening. We actually lost our first precious school-age child last week to the virus, which struck in the hearts of every educators. As a teacher, I'm calling on you to wear your mask in public. If you want us to feel safe going back to school in August, in a study done by Time, 20% of educators have said that they will take an early retirement or leave the profession if they don't feel safe returning. We are all in a teacher shortage as is. Please wear your mask so that we can get back to doing what we all love, and that's teaching. Thank you.
All right, thank you, Jamie. And I will move on with what I was trying to say. Hopefully that this is much better. So Oklahoma educators are eager to get back.
We are sorry about that technical difficulty. We're working to get Alicia's connection repaired. In the meantime, can we hear from Morgan McClellan, who is an upcoming senior at Rattan?
Hi, my name is Morgan McClellan. I'm a rising senior at Rattan High School. So I'm going to give a student's perspective on reopening schools and some realistic precautions we could take when doing so. There are a lot of risks when reopening schools, but I think if we do take those necessary precautions, I think that by doing so, it would benefit a lot of people. I do know that the best possible thing you could do if you are returning to school is staying within 6 feet, a safe distance from other people. But personally, my school's main hallway is only a few feet wider than that, making it near impossible to stay within a safe distance of other people. However, some more realistic precautions you could take is enforcing the washing of hands, making sure people are wearing a mask, generally staying away from other people, and talking to students about not touching their eyes, nose, or mouth with unwashed hands. I know from experience that a lot of students do better when they are able to ask their teachers face-to-face questions and are in an environment where they are not only getting their work done, but are with someone who can help them understand that work. I like the routine that school gives me. During these past few months when I had to do schoolwork online, I often found myself procrastinating and not feeling as if I truly comprehended anything I was being taught. Online education is a foreign concept to a lot of the students who have been in the school system for most of our lives. For some people, school is an escape from their home lives. It provides a sense of security for them, and to have that taken away so suddenly without knowing if it's going to return soon or not is hard to say the least. Not only that, but being able to talk to someone outside of your home and getting to have some sense of normalcy during this time that school provides is essential, in my opinion, to students' personal development. Providing an online program through each school system would be a great option for those who don't feel safe going back to school physically, or who are immunocompromised, or who live with someone who is immunocompromised. I'd also like to say that what I've heard from school, blended learning, which is an option for students who would like to do both online and in-person schooling, is a great alternative to either stream. The coronavirus is not a thing of the past. It is something that's still very present and needs to be taken into high consideration with making decisions basically whenever to reopen schools or not. Nevertheless, in my opinion, reopening schools is a risk that's worth taking as long as we make those necessary precautions, keeping ourselves and everyone else safe. Thank you.
Thanks, Morgan. All right, so hopefully we've gotten my audio problems solved, and I'll try this again. Thank you so much. I'm Alicia Priest, president of the Oklahoma Education Association, a 26-year educator from Yukon, Oklahoma. Oklahoma educators are eager to get back to the classroom and see their students' smiling faces, looking back at them in person. We got into this profession to build relationships with our kids and colleagues and to help make our communities better. The love we receive in our buildings every day is the most rewarding feeling for an educator. This is why it pains us to admit that there is still so much to be done before we can return back to our schools safely. We cannot support school starting when it's dangerous. We shut down schools March 25th. That day, our state had 164 new positive cases. Wednesday, we set a new record with 1,075. And Kevin Stitt became the first governor in the country to test positive. We knew the pandemic was dangerous then, and we know the pandemic is dangerous now. We took extraordinary measures in extraordinary times to move schools to distance learning. Teachers, students, parents, and caregivers all adapted to a learning environment completely different than anything they had ever prepared for, and yet they made it work. Today, the infection and death rates are even higher. We are being told to proceed as normal. This is not normal. Hard decisions were made in March, and we believe those decisions saved lives. It's time to make hard decisions again. If Oklahomans want school to start, Oklahoma leaders need to make those hard decisions now. We cannot ignore this pandemic. We cannot turn a blind eye. Schools will not magically have extra resources like personal protective equipment, sanitizers, cleaning supplies, and substitute teachers. Sick leave policies will not rewrite themselves to reflect our new normal. What happens when a teacher tests positive? Will they be forced to use sick days? Who notifies parents? Who gets tested? Who ensures that they are tested? How long before the tests come back? Who pays for those tests? How does a classroom packed with 35 children try to socially distance? How can we protect our teachers, support professionals, and children who are at risk of severe complications from this terrifying disease? Our leadership has failed to take active measures, and we are staring those consequences in the face. We shouldn't have to be in this situation. We shouldn't have to beg our leaders to care about the lives of our children and colleagues. But if they abdicate their responsibility, then we will not hesitate to defend the safety of our schools. Schools can't even afford full-time nurses, let alone epidemiologists. This is why we rely on state experts. To ensure a safe learning environment, the state must require masks for everyone inside school buildings unless medically inappropriate. The state must have PPE, soap, hand sanitizer, and all cleaning supplies readily available through their supply chain. The state must mandate protocols on when to shut down a school and when to shut down a district. The state must address the sheer number of students in one building, one bus, one cafeteria at a time. The state must provide basic supplies like touchless thermometers. If we don't address these basic needs, we are not ready to go back to school. We are willing to teach and learn in safe environments. And just like this spring, we are ready to do what it takes to teach our kids. But safety must be our first priority. If it's not, kids will die. Educators will die. OEA provides our members the option to have a free will drawn up by our legal team. We're getting dozens of requests every day, and all of them have the same question. Can this be completed before I have to go back to work? We all miss our students so much, and we all wish school could go back to normal. But there are some of our colleagues who literally are planning for their deaths. This is unacceptable. It is inhumane. To those who say only people who are vulnerable are at risk, well, a large percentage of our students and staff members have underlying conditions. Do they not deserve to learn and work in an environment without being scared for their lives? Public education in Oklahoma is for every student, no matter their zip code, no matter their race, no matter their medical issues. There is no acceptable number of sickness or death. One is too many. Even avoiding death should not be considered a win. Children will be hospitalized, adults will be hospitalized. This is a novel virus. We don't know the long-term effects, especially on children who deal with said effects for the rest of their lives. We must protect our public schools as if they house our own children, because they do. We will come back. We'll be back in our classrooms. We'll laugh, we'll learn, we'll love together in person again, but only when it is safe, because we never stop standing up for the best interest of our students. And with that, I would like to introduce Dr. Dwight Sublett, President of the Oklahoma chapter of the American Academy of Pediatrics. Dr. Sublett.
Thank you, Alicia, and good morning to everybody. I certainly appreciate the opportunity to speak to you all this morning. A little background, I've been in Stillwater as a general pediatrician since 1983. And during that time, we've experienced a lot of things over the years, various illnesses, bad flu years, a lot of diseases that we once dealt with are gone now because of immunization. So there's been a lot of changes over the year. But I can honestly say, and I think my medical colleagues will agree almost uniformly, this is unprecedented. This is unprecedented. This came on quickly. When it came on, it was rather an abrupt change that we had to make on the fly. We've been learning on the fly as far as how to treat this illness, how to isolate, what works, what doesn't work. And obviously, everybody is seeing the numbers of cases worldwide, nationwide, the number of deaths, and this is an absolute disaster. In Oklahoma, the numbers mentioned, we had our highest day yesterday. I think it was 1075. We were about almost 23,000 new cases in the state, and over 400 deaths. Now, Oklahoma is not immune to disasters. We've dealt with all sorts of disasters. I think of tornadoes, I think of floods, I think of droughts. We have dealt with disaster. We're a tough group of people, and we have had disaster plans in the past. If there ever was a disaster, COVID is a disaster. And we need to address that, look at it straight in the face and address it as. I have great admiration for the educators in our state. My wife is a retired educator. My mother taught school. I have had firsthand experience with what they do on a day-to-day basis. And even in a normal time, quote normal time, their challenges that they deal with on a day-by-day basis are monumental. Now we throw in a condition, a very contagious disease, much that we don't know about. We know more than we did 9 months ago when this first started, but we're still learning, and we're talking about going back to school. Now, the Academy of Pediatrics nationally is advocating for a return to school, but the initial statement, I think, was taken out of context that we were pushing this almost at all costs. That is definitely not the case. What the Academy recommends is that we look at the science of this thing. Look at the data. Don't be subjective, be objective. How are we doing? What's the numbers? Look at it day by day. How are we increasing? And we're going to need to do that here in the state. And we're going to have to see where are our hot spots, where, who's doing well, who's not. And most of all, we need to develop more of a spirit of unity in our population, that we're all in this together. This is not just a simple flu or a cold. This is a big deal, guys. This is a big deal, and we must treat it as such. There are three, we know from one thing that we have learned, particularly from our European friends and from the Japanese, from Australia and other places, what works. A good example is Italy. Italy had a very strong outbreak, and they did basically the three things that everybody's been hearing about. First and foremost, wear a mask, People say, well, that's an inconvenience. It affects our personal freedom. Well, sometimes you have to make some choices. You have to make a sacrifice for the common good. We know, actually an article came out this week in the Journal of Pediatrics and Child Health this very week, where the World Health Organization looked at 172 different situations around the globe as far as where they practice wearing masks, social distancing, hand hygiene. And we know that when people wear masks and when everybody's in compliance, that decreases, even with the cloth mask. We're not talking about the N95 type mask. That decreases the amount of transmission of disease by about 85%. If we do social distancing appropriately, that also has an effect of about 82% on decreasing the transmission of the virus. That's substantial. We can reduce the number of cases, but we've got to be committed. We've got to all be on the same page on this thing. If we are not on the same page, we are staring a disaster in the face. This is summertime. Summertime in pediatrics is checkup time, sports physicals, getting ready for school. We don't see a lot of viruses. We don't see a lot of illness. Now we get around October, November, then we start throwing the flus, the colds, the strep throats, the pneumonias, the bronchitis into the picture. And you couple that with COVID, that's a recipe for disaster. Okay. And we've got to look at it that way. So my plea to the state, to our population is, let's look at it that way. Let's look at it as if we're staring at a level 5 tornado right straight in the face. And what are we going to do? And how are we going to react to it? We've got to be flexible. We've got to be informed, first of all, what's going on, how are we going with things, and we've got to be flexible and be able to move. There's going to be different situations in different parts of the states. There's going to be hot spots. There's going to be other areas that are not so involved at any time, but that can change. That's what we've been seeing in our neighboring states, particularly like Texas. South Texas was involved. Now it seems to be spreading northward. So it can change, and we have to watch all of that. So I think as a physician, I'm going to make the plea that we all work together. Take the inconvenience. It's okay. We'll do it for a while, and if we can get through this and succeed, then our personal freedoms will expand again. We can go to the movies, we can go to the restaurants and not feel like we might get sick. We can take a trip on an airplane, things like that. That's what we got to work for here. And the other issue too, and then we're seeing this like in Florida and Texas right now. If we do not do these things, the medical system, we're doing pretty good right now. But if we don't do these things, the medical system will get overwhelmed. I can guarantee it's going to happen. Okay, and we've got to keep that in mind too. So I hope that information is helpful. And I think the thing that the Oklahoma Academy of Pediatrics is, emphasizing is we need to follow those 3 basic guidelines, and we need to follow them strictly. And we need to be supportive of our schools. We need to be right there with them. We need to be hearing what's going on, what the challenges are, and we've got to be able to make changes quickly as those changes, because it's going to happen. Well, it's not going to all just go smooth. So we have to all be together and working together with this. And I hope that information is helpful to you. Thank you.
Thank you, Dr. Sublett. Now I'm going to invite my colleague, Mary Best of AFT Oklahoma, to speak. Mary?
Good morning. I'm Mary Best, president of AFT Oklahoma, and one of the districts we represent is Oklahoma City Public Schools, the state's largest district. COVID has forced all of us to adapt to a new way of life. We are now approaching the start of school, and the virus is out of control. As educators, we do not believe we will be able to return to school as usual. Schools may need to delay opening, use a modified schedule, or return to online learning. Upon returning to school, safety requirements must be in place, and we must all adapt to a new normal. Teachers and staff are anxious and are not only worried about their health and safety, but the health and safety of their own children and loved ones. 38.5% of Oklahoma City public school teachers have expressed concerns about their own personal health. We believe students and staff should be required to wear masks. When we return to school in Oklahoma City, teachers and staff and secondary students will be wearing masks, and elementary students will be expected to wear masks. Wearing masks needs to be a statewide requirement. For mask wearing to be effective, everyone must wear a mask. It is a safety issue, not a political issue. PPE equipment and safety measures should be provided at all school sites, and safety measures will need to be enforced to make sure everyone is protected. Temperature monitoring, hand sanitizer, soap, paper towels, and hot water must be available to all persons, with deep building cleaning each night. On July 8th, Oklahoma City AFT conducted a school survey for teachers. 89.4% of teachers believe staff and visitors should wear masks. We also asked if the district should require masks for students, and an overwhelmingly 81.4% of teachers responded yes. The district and school board listened to their teachers and staff, and OKCPS will require masks. We want other districts to follow suit. Teachers are extremely anxious and somewhat uncomfortable about returning to school, but teachers want schools to reopen, but they want schools to reopen safely. Teachers are concerned about students learning. They are concerned about students falling behind, but most importantly, they are concerned about their health and safety. To open our schools safely, we will need additional resources. Most of our schools are already at the top of their budget. Funds will be need to be provided to protect our students and teachers, our bus drivers, our cafeteria workers, and all school personnel. If we want to return to normal, we must all be willing to do our part and work together. Thank you.
Thank you, Mary. Now let's hear from Reverend Clark Fraley of Pastors for Oklahoma Kids. Pastor Clark.
Hey, thanks. Well, I'm not a doctor and I don't pretend to be, so I won't offer any advice or evidence there. I'm a pastor of 20 years, 11 years here in the Oklahoma City Metro, a native Oklahoman and co-founder of Pastors for Oklahoma Kids. And our primary concern is to advocate for the 703,000 kiddos that are in public schools. As a pastor and our group or network of pastors of about 125, we listen to our community. We know the heartbeats of our community. We have pastors in urban and rural and suburban context all across the state. And we did a survey, and 100% of our pastors are very concerned about the health and safety of our students as they return to school. And so at the end of the day, for us, health and safety are paramount values for our kiddos. COVID-19 has killed 432 Oklahomans. That's 432 too many, in our opinion. And so we want to do everything possible in order to protect those who have not yet been infected. And when I have conversations with teachers and administrators and support staff, the consistent thing I hear is they love their kids. They want to go back to school, but they're afraid that they're not going to have the resources. Like we have shortchanged our public schools time after time with inappropriate resources, textbooks that are falling apart, vehicles that can barely run down the road. How is this going to be any different? And I don't know what to tell them. I don't know an answer to give them. We can make up lost ground academically. We can make up a prom or a basketball game, but we can't bring back dead people. And I just don't understand how we can approach this any differently by taking the utmost concern for the staff and for the kiddos that are going to go back into these schools. Jesus taught us to love our neighbor as ourselves. In fact, he said it's one of the two greatest commandments that we can do. We have to do better for our kiddos. We have to do better for our staff, our administrators, our educators, and these are our neighbors. So 2 big suggestions. First of all, I think we have to insist on a safe reopening. There is no timeline for this. There's no arbitrary date. No federal authority can tell us this. We can't afford to have magical thinking. One of our pastors penned an article this morning. He sent it to me really early, and I think he sums it up perfectly. He said, are we treating our kids as canaries in the coal mines? We can't just send our kids back into an environment that we have not fully vetted and fully made safe as possible. So I think we have to empower local decisions. We have to not let this decision be geared towards economy, but let the local decisions based on the safety and health be paramount. We're not in a time of downward community spread. We can all look at those. I mean, I'm a pastor, but I can look at a chart and see that it's just rising. So we have to, insist that we have medical grade PPE for our staff, that kiddos have the appropriate things to cover their faces with to not get this. We have to have cleaning supplies. There's a lot of questions, I think, for funding and for getting those supplies. And our churches are rallying. I've heard of our churches. We've asked for ideas, and we have churches that are rallying, gathering gear, but we can't do that alone. So we definitely need support in that way. And then the second thing is for us to provide instructional flexibility that's already been mentioned. Just, timelines and schedules, whether it's virtual or blended or less than 5 days a week. We've got to get over this arbitrary day of the week thing. This is a pandemic. This is serious. And we need to have flexibility for our local school boards and decision makers and superintendents so that they can make those decisions and not be penalized in any way financially or with any sort of regulations on them for that. It's just common sense. There's no way we can jam 28 pre-K kids in one room meant for 18 and expect good outcomes. That's just insanity. And so we have to have some reality. We have to have some gut checks, and we have to just stop putting it off and start getting on board right now. Ultimately, pastors are going to look towards protecting human life, the lives of the children and the lives of our educators in our local schools. And that is our, I would say, our paramount message is that human life must be valued in this. Thank you.
Thank you, Pastor Fraley. And thank you to everyone else who has participated today. Thank you for bearing with me as I had technical difficulties. Somebody may have bingoed on that third time that I had to go off and come back on and try again. But at this time, we'll take questions from the media. Remember, media, if you have a question, please put your name, outlet, and person your question is for in the chat box, and we'll go in order of requests. So
we have our first question from Ken Miller, Associated Press, a question for Alicia Priest. Ken, if you want to come off mute and ask your question.
Good morning, and thank you, Ms. Priest, for your time. I've got to ask you, just kind of cut to the chase here. You mentioned a couple of times, not willing to go back until it's safe, and willing to return only when it's safe. And you're talking, of course, about the supplies, the masks, PPEs, so forth. Is this something that teachers? Are you saying that a strike, I hate to use the word, is on the table?
That's a great question. Thank you for that, Ken. So what we're saying is, in order for us to have face-to-face school, certain guidelines must be in place. We must have the safety equipment necessary to keep our kids and our staff safe. We must have protocols and policies in place that across the state keep our students and staff safe. And those things need to come from our state leaders. Our educators want to be teaching the students. And if they can't do it in person, then let's figure out how to best do it virtually until we can come back safely. But we are not willing to risk the lives of our students and staff and come to schools when they're not safe.
We have Patrina Adger from KOCO5 with a question for Alicia Priest.
Thank you.
Hi, Alicia. I want to know what is next. Schools are going to be starting within the month. And how long are you all giving the state to take action?
They need to take action immediately. We've known that that August was coming since the shutdown in March, and we should have had state leadership making sure that our districts had the equipment necessary to be safe in our schools when we come back. We had a meeting with our board of directors to discuss this issue, and one of our board members that is from an urban suburban school district in the metro area said that they had ordered supplies, but they keep getting bumped because as we are seeing a rise in numbers of cases, all of that PPE and cleaning equipment is automatically diverted to the hospitals where it should be. But that then means that our schools are left without the medical supplies or the cleaning and health supplies necessary to have an in-person safe school start. So we've got to do something about that before we come back to school.
Are there any other additional questions from media? Okay, I think those are the only two that we had.
Thank you all so much for bearing with us and being with us. And let me leave you with this. Educators, teachers, support professionals, administrators, we all want to get back to school, but it must be done safely. Thank you so much. And thank you for helping us make our schools safer by getting the message out.